Mary, quick question for you. The doctor's ordered a couple of medications for us to give to our patient. I normally wouldn't be terribly concerned about that. I'd go ahead and give them, but we do have D5.5 with bicarb in it. So I want to make sure that we'd be able to give this through this particular IV since this is the only thing that we have, see if it's compatible or not. Have you used Lexicomp yet? Okay, so what I'm going to do is I'm going to show you how to get into it through the computer and kind of show you some things about it just so you kind of know what to do with it. It's got a lot of tools in it. So let's go ahead and take a look at that. So we're looking at our resources, and so we're looking for Lexicomp. So when you actually pull up your desktop, you should see a little white square with a blue tree in it. That would take you to the intranet. Okay, so if you go to the intranet homepage, you're going to see this, okay? And so if you go all the way down to the bottom, you're going to have your Lexicomp online, so you could click that, okay? If you're in your actual SCM, you can go to Tools, and you will have, Lexicomp right here. You can click either one. It's not a problem either way. So we're going to click that. We're going to go to Lexicomp. Going to make this a little bit larger. And so what you're going to, we don't need to use cookies here. So what you're going to see is you're going to see different tabs. So depending on what you're going into Lexicomp for, you'll be able to kind of pick whichever one you want to do. So for example, if you go to the left and go to interactions, you can search drugs to see if you have any interactions with them. So for example, if you have metoprolol, and then you do, let's do metoprolol, that one's fine right there. And you want to do protonics, you can do protonics there. And then you can analyze. And so up here you will have a key and interaction analysis key. So this will give you some idea of what kind of interactions you may or may not have. So if you go on down, you'll see that there's no interactions of risk level A or greater identified. So it doesn't seem like there's an issue between these two medications. If you want to analyze two other ones, then all you have to do is hit clear, and then it'll take you right back to the beginning where you can search for drugs to look for interactions. The next tab is drug ID. Okay, so if you click on that one, if you have some information about the pill you're looking at, for example, we'll pull up this pill. Okay, so this pill will give us some information from it that we can plug into the side over here, and then we can see what kind of medication we have. Okay, so we're going to go imprint side 1, says M. If you look at it again, there's an MT1 on the other side. So if you use the imprint from one, you got to use the imprint from the other. Some medications only have imprints on the one side. Just plug in all the information that you can. So the first side was M, the second side is MT1. And then in the dosage form, it is a tablet. You want to go down. So the shape is a round. The color is, for this particular pill, white. And we don't know, say, anything else about this particular medication, so you want to hit search and see what you can find. So we do have a search result, okay? And then when you go down here, it says no image. Some of them will have a picture. This one says metoprolol, imprints MT1, which is exactly what we had. This will tell you that it's the extended release tablet for 24 hours. Strength, it'll give you more confirmation information, so you can go with that. Now, if you don't feel terribly comfortable not having an image to actually compare it to, that's fine. But if a physician says, what medications were they, you can say, well, it looks like it's a metoprolol 25 milligram. Okay, and that will be able to give the physician a little bit more information, or pharmacy, or whomever may be inquiring about those medications. Sometimes we have patients that will come in and they put all of their medications into one bottle, and so sometimes we have to try to figure out what they're actually taking based on those. So when you have a preceptee or a preceptor, it's always a good idea to see what kinds of medication those patients are on when they come to the hospital. Okay, So our next one is calculators. This one's also a very exciting resource for people as well. If you look over to the left-hand side, this will give you an A to Z reference on different kinds of calculators that are available. Okay, so if you wanted to do BMI, you can just tap in BMI search, and it will give you BMI for age boys 2 to 20, for age girls 2 to 20. Okay. So if you wanted to go back and look at all of them, you should be able to. And then you would be able to, just kind of scroll down. If you couldn't find what you were looking for, you might be able to find the same calculator with maybe a little different naming. So you can go down. This is the Apache 2 scoring system by diagnosis. There's an adjusted body weight, ACLS for neonatal and pediatric. There's all kinds of different calculators that you can use in order to see. For the one that we did, BMI, this is body mass index, but the other one that we did was for the boys and girls. So you can probably find something that you're looking for either through the search function or just through going through the A through Z. But there's just a lot of different things in here that would maybe be helpful for whomever's looking for resources. Excuse me. The next tab is drug comparisons. So you can do data view, you can do monograph view, you can do whichever one you want. The first one is, so for example, if you had a medication that you wanted to look up information on, we can again do metoprolol. And let's also do, metoprolol IV, and let's do Protonix again. IV, just in case you have to give 2 medications through a single site that patient has. So you want to compare those two, okay? And it will give you different things that you'll be able to look for. So adverse effects, common for metoprolol and Protonix. So if, say, headache was common for both of them, then it could be either medication that's giving them a headache. If they're starting to have bradycardia, you're going to know it's probably more the metoprolol versus the Protonix. Okay, so it'll give you common effects, more frequent effects, less frequent, rare. So it'll give you all kinds of information about what you're looking for. Unknown incidents, if your person says, oh, I all of a sudden have blurred vision, well, you can always kind of pull this up for medications that you've recently given and see if you can figure out what that's from, or at least give some kind of idea of what that's from. So we'll keep going. So it also gives you indications for why they would actually be taking that medication. So for example, for cardiovascular reasons, you might be taking it for paroxysmal atrial tachycardia. Okay, or for GI issues, your patient might be taking it for, GERD or stress ulcer prophylaxis, whatever the reason is. But this will kind of give you a little information about that. It can also give you information on pregnancy concerns, just in case, lactation, just different kinds of things that you might be wanting to be careful of, contraindications and precautions. So if your patient, for example, is already bradycardic, you don't want to give them a medication that can make them more bradycardic. So just kind of, sometimes going back and taking a look, or if you're not familiar with medication, sometimes this will definitely help to get you a little bit more information on what it is that you're looking for. Okay. It also does give you drug-drug interactions, just different kinds of things for you as a resource. Okay. So Trissol's IV compatibility. We typically use this a lot in the ICU because we want to make sure that we're not giving medications that aren't, intravascularly or intravenously incompatible. Sometimes we have to put multiple medications together because we're limited on our sites. So we want to make sure that we're able to do that appropriately for our patient. Okay, so let's search IV drugs. Again, we'll do our metoprolol. And for our IV solutions, we'll say that we have D5 in water. Okay, just to kind of, metoprolol I'm going to add there, D5 in water we've added. So let's analyze that. So it will give us a little legend right there to look at. and it will say metoprolol tartrate is fine to give with itself. Yay, always good. And then with D5 and water, it says C. So let's go back up here to C. And it says that it indicates compatibility for this method. So you can give metoprolol through this particular solution. Always a good idea. Now, if you want a little bit more information about the solution that you're giving or the medication, you can go right in through that little link and it will give you more information about these other two. Okay, so different studies and different compatibility findings. So that's kind of helpful. Drug reports, for example, by adverse reaction. Okay, so you can click on that. If you have medications that you need to give, that you want to see if they're going to cause any issues, so you can click that, and you can click indicated if you want it or contraindicated, but let's do may cause. So let's do metoprolol, just because that's kind of a frequent medication that some people take. Okay, oh, sorry. We'll do disease condition, we'll do congestive heart failure. So we'll just pick that. So let's go over here. Let's go to analyze. Okay. And so adverse reactions, so medications that may cause congestive heart failure. I do apologize. So may cause congestive heart failure. So these are different medications that are potentially going to cause congestive heart failure. Of course, it really depends on your patient, their comorbidities, their current situation. But sometimes if you have a patient that has that goes into congestive heart failure / pulmonary edema, sometimes recent medications that we've given may have some impact on their overall status. So it's always kind of a nice idea to go back through and see if there's anything that may recently have been given that just kind of tipped the balance in what was going on with them. Okay. So you just kind of look through the list. Let's see if there's anything in here that's exciting that we can kind of look at. Oh, it's paused. So, let's go Reglan. A lot of patients take Reglan. So the adverse reactions, cardiovascular edema, palpitations, these are some things that they can actually cause. So part of the reason that well, for this one, for naproxen, part of the reason that this may cause congestive heart failure is that you have fluid retention and increased thirst. So if you have a patient that's already thirsty, that's on INO, that's getting naproxen, then it may cause them to be more thirsty, drink more fluid, and then eventually go into congestive heart failure. So that's kind of, putting the pieces together sometimes. Okay, sometimes that critical thinking is incredibly important to kind of understanding what's going on with our patients and why they are having, issues or complications that we weren't necessarily expecting. Okay, so we're going to go back here. Going to go back one if it's not frozen. Okay, so let's do by indication this time. So you can do things that are indicated for, again, for congestive heart failure. So you can kind of take a look at it and see what kinds of things the patient could potentially be on in order to kind of maybe prepare for orders that you may get from the physician. Okay, so if you have a patient that's in congestive heart failure, you would expect that the patient could potentially be on a diuretic. So they could be on furosemide, they could be on hydrochlorothiazide. So we'll say, furosemide, okay. So why would they be on it? They would be on it because it would help with the edema. For heart failure, hepatic or renal disease, acute pulmonary edema, that kind of thing. So sometimes it's nice to kind of go through this particular resource in order to be able to find some information on why you would expect or why they're on things and what you would expect in order to kind of help speak with the physician a little bit more comfortably in asking for certain medication that the patient might actually need. Okay, so let's go back to this next tab up here. So let's go to patient education. Okay, so if you click on that one, let's do CHF. We'll do metoprolol and furosemide. Let's see what we can find. Okay, so we can't find anything there, so you have to put them in one at a time. So CHF, let's do that. Sometimes we learn by failing. Sometimes we learn by winning as well. So anyway, we know that we can't put them all together. So let's go down here a little bit. So what kind of heart failure are we looking at? So if we have adult populations, we would hit heart failure adults. Of course, if we had pediatric patients, and if we had a patient that was maybe, say, an international patient that came from somewhere that was young, that had been vacationing, and had developed Crimean Congo hemorrhagic fever, then we would pick that. So let's go with heart failure adult. We'll add it to our packet. Okay. And let's go to the leaflet preview. So this is the copy of what the patient would actually get, or you can hand to your patient. Okay. So heart failure adult. Okay. So it gives some information about this topic, gives you normal heart, signs of heart failure, different things, how they would test for it, causes, what worsens it, what are some signs of it, how and why the doctor will diagnose it, how they're going to treat it, any lifestyle changes, drugs that may be needed, dietary changes, fluid restrictions. When to call the doctor is also a very good part for them to have as well, because we're very good about educating about the disease process, and they're so overwhelmed by the time we get to, if you have these issues, call your physician. They're kind of worn out memory wise. So it's always a good idea to have this, what I need to do to call the doctor in order for them to know what to go back to, so they can, if they have issues, then they can look and see if it's something that they should call their doctor about. Overall, of course, if they have questions, they probably should. But sometimes it's maybe, I'm having chest pain that's different chest pain. Well, chest pain, you should really call your doctor. If you're having issues with, just feeling kind of blah, is that necessarily something to really call right away for? Doesn't look like it's on this list, but let's go down to this list and see if we can find anything. Being very weak or tired might be, something that they need to call the doctor for. So you always want to kind of give them the review of the information that they have, just so they kind of know where to go when they get home. Okay. Any helpful tips that they might have, where they can go, what their resources are, that will be extremely helpful for them. So you can always print this out and give this to them, or their family members. Sometimes they have questions. Okay. So, formulary monograph service. So this I probably wouldn't necessarily use too terribly often, but sometimes when they have new medications, it's kind of like nice to kind of go through or see what's coming up. So this is, a section where you can go to new drug reviews. And so for January 2019, they'll have just different things that they're looking at and just a little blurb about what medications it looks like they're going to be potentially coming down the pike. So it's kind of nice to have a little heads up, or, to just kind of see where medications are. So that's what that's all about. And over here, P&T formulary reviews. Again, this is probably more a pharmacy that would use this, but drug use evaluations. Again, that's also kind of a nice thing to just, if you have time, just kind of go and see what medications they've got on the list. So let's see, mesalamine, let's take a look at that. So this is what it is that pops up. The mesalamine's there. We're going to open it. Oh, I can't do it on this one. That's fine. So on your PC, so it will just kind of give you almost like studies of what that medication looks like. So sometimes you can pull it up, sometimes you can't. That's fine. As far as toxicology goes, you can go in here and you can, just, put anything in here. You can put, say, antifreeze. PEZE. Search. See what we can find. We're waiting for Lexicomp to come back to us. Sometimes it takes a little while. If you're at a workstation, sometimes those workstations are pretty quick. If you are on one of the mobile workstations, sometimes the situation is a little longer. But we are definitely waiting. So if you need to move quickly on this, you can always have somebody that will be, able to kind of look for you if you're taking care of your patients. And we're waiting. There we go. So search results for antifreeze and toxicology. So this is just kind of a rundown of information about antifreeze. Okay. So it's going to give you lab tests. So what you would use. Okay. And then if you hover over this, this will give you information so you can go to a particular area rather than having to look through a whole bunch of stuff. So, for example, if we had a patient that drank alcohol and antifreeze together to get that, super intoxication, then if you get their lab results back, you can just jump to critical values and see what that is. So toxic is greater than 20, critical is greater than 50, fatal is greater than 300. Typically, if it's greater than 50, then the dialysis nurses will come in and will actually put a line in and will dialyze that patient until the level is down less than 50 or very close to 50. So it just depends. But if we go back here, we'll go back, and then it will also tell you over here, like, related information. What does it include? How do you, what kind of specimen you're looking for, what container you need to put it in, processing, storage. It will give you all of this information that you can look up for whatever you're doing for this patient, for this potential lab that you're looking at. And we're waiting. Okay, so Lexicomp, okay, so it will give you just certain information as well. So if you hover over that, this will also give you more information, like over here to the side about, what it is that you're looking for. Again, you can jump to it, antidotes, decontamination, anything like that. Okay, supportive therapy, stabilization, whatever it is that you're looking for. Okay. And this also gives you an idea of what this particular solution is going to be found in, household, products that you might use. Most of it, of course, is going to be the antifreeze that you would get from Prestone or Quaker State or something. So this will give you also, if you come over here, health effects, carcinogen, how you dispose of it. So this is very helpful, not just for nursing or the medical field in how to kind of deal with it, but it's also very helpful for somebody just kind of in the field as well. I do believe that people can get to Lexicomp online, but I think it's probably a little bit more limited. So otherwise, that's it. So now that we've gone over our Lexicomp, I'm going to go back to leave toxicology mode. And then you've also got up to date over here. So this will, if you wanted to do a search in here, this will give you, if you wanted to do, for example, congestive heart failure, you can go in there and it'll give you different articles and things about congestive heart failure. Okay. There is a mobile app that you can download just to kind of have it on your smartphone. And then there's also just other things that you can kind of look at for, quick reference guides, product updates. Let's go to training videos. So this has, kind of a search function on Lexicomp on how to use it. Or not a search function, a video function, so you can find different ways to go through these things if you have any question or your preceptee or your preceptor wants to kind of go through it a little bit more. Okay. Excuse me. Coming down here, quick reference guide. You should be getting this quick reference guide in this particular program. So if you want to take a look at it, then you are more than welcome to. Oh, we can't on this one, unfortunately. Again, I do apologize. Also, there's these are the things that are upcoming. So if you have any questions, definitely talk to your preceptor or talk to the education department.